All right, good morning from Wichita Public Schools, and we're live at the Animal Hospital in the Sedgwick County Zoo. I'm passing it over to Clint. Good morning.
Good morning. Thanks so much. We are live here at the Oliver Animal Hospital out at the Sedgwick County Zoo. Another awesome adventure coming your way today. And I am here with Jenny, and she's going to be our tour guide this morning on the Animal Hospital. So I will turn it over to her.
Hi everybody, good morning. I am Jenny. I'm a veterinary technician here at the Oliver Animal Hospital at the Sedgwick County Zoo. And I'm going to just take you guys on a quick tour. If anybody has any questions, let Clint know and we'll get them answered as quickly as we can, I think. So if you guys want to come this way, this is the entryway to our hospital. We do have a receptionist area. We have had a receptionist here in the past, we don't currently, but this is the entryway into the hospital here. We've got our doctor's offices. We have 3 doctors and this is their area. We're going to go back this direction. You turn on some lights. We have a wall of pictures that are fun to look at. If you ever get to come tour in person, you can take a closer look at these photos. Back here is where the action happens. We have 3 veterinary technicians, and this is our office area. We also have a mini lab in this area, so we can do some small blood work diagnostic things in this area. This room is our treatment room, and in here we will see animals initially. If they come in on an emergency, we will triage in here. If they come in for just minor treatments, we will work on them in here. So we'll come on this way. We've got a cleaning space in here, and one of our volunteers is in here helping us take care of that stuff today. And then you can come on around the corner here. I think they're going to have a flamingo in here doing treatments for us here in just a little bit. This is kind of a big loop. This is our intensive care ward. So if we have animals that are staying in the hospital with us for treatments and they're the size that we can house in here, we will keep them in here. This is our radiology. We do x-rays in here. If you're wondering what radiology is, we can put in the animal's information. We take their picture on there and then it pops up over here. So I have an image to show you guys. So this is a pretty neat image. You can see, I'll let you guys kind of guess what it is. The answer is on the screen if you look real close. But this, well, we know what this is. This penguin has an egg, but she also has a metallic foreign body in her intestines here. So we took this x-ray. We were pretty sure she had an egg. We were a little bit surprised by the metallic foreign body, and we have been keeping an eye on that right up to her procedure. And then I'll give you guys an idea of what we do for her procedure. We did an endoscope, where we scoped her. And I have some video of that in the other room here. This is our surgery suite. So if something comes in that needs an actual surgical procedure, we will typically do that in here. And then I'm going to show you guys a fun video. So we're going down into the penguin's intestines. We're going into their mouth. Let's see, I have it good. So that's a penguin's mouth. Go back one more. So you can kind of see we're following, this penguin is intubated, so we have a tube in her throat. And then we're going to go down her throat with the scope, and that'll go into her upper GI. You can kind of see us headed that direction. And then this is some penguin GI that you're seeing here. There's some food bolus there. And then let me get to the really fun part. Okay, so this is the fun part. We got down there with our scope and look what we found.
Wow.
So that is a penny, and that movement that you're seeing there is her heartbeat. And then we used a little clamp on the end of our scope and grab a hold of that penny. Once they get a good grip on it, they will start pulling that thing out of there. So you can see they're exiting, pulling it all the way back up and out of the lower intestines through the stomach, and then they'll come back up out of the esophagus. They're almost out here. We have to take it out slowly just to make sure we don't cause any problems. So the penny is now out. So that was a little video of one of the procedures that we do with using some equipment here at the zoo. This is our endoscope. The doctors will hold on to this part of the machine right here, and this is kind of the driver, and it drives this end, which is the video. So this end will be into the animal, and then the doctors will be moving this, and you can kind of see, I don't know if you can see that on the video, how they have to steer this thing to get a good look around. It moves in all directions, but they can't see it while they're steering it. They have to imagine which direction they're going because this end is down into the animal. So that's pretty fun, some of our endoscopic equipment.
So we have a question coming in from Macy, wondering if that's hurting the animal.
The penny being in the animal is actually causing a lead, metal, or zinc toxicity, which is one of the reasons we wanted to get that penny out of there. Penguins are very curious, so they eat a lot of things that they probably shouldn't. So when a shiny penny is thrown into an exhibit, that penguin would grab a hold of that penny and just eat it down. So this penny was minted in 2015, so it hasn't been in there for more than 6 years, but the penny is very, very broken down. You can see there's a hole in the middle of it. It's super deteriorated. I have the penny, I just don't have it with me. We'll grab it later on in the tour so you guys can get a good close-up look of it.
That's awesome. Big shout out to our animal science class at Jardine Middle School. They are here with us today, and anyone out there, if you have questions, please put them in the Q&A and we'll get to as many of those as we can.
Okay, we're going to come back this way. I think they have the flamingo in treatment right now. So this flamingo, his name is Ampy, or her name. Her name is Ampy. She has part of her beak is amputated on the top. She also has some concerns with her feet. So today we are going to do laser treatment. It's a cold laser treatment, so it actually helps the healing process speed it up a little bit, as well as if there's a bone or deep tissue injury, we can use that to help speed up healing. So they're going to do laser today, and then once they're done with laser, they're going to put some ointment on there that helps keep moisture in her feet. Flamingo feet, lots of water-filled feet will crack if they get too dried out.
So they're wondering, is there a lot of, do a ton of animals come through here every day, or?
Most of our animals that come through here are scheduled. So we schedule procedures a lot of the times on the animals that we treat. So the majority of the animals that we see in here are scheduled because we're doing an exam, they're going to a different zoo, or we're treating an injury. Some animals will occasionally come down on emergency because of course that happens with humans and with animals. And the emergency animals, of course, we'll see right away. A lot of times we'll triage, which means we'll look at their injury and try to decide what is if it's life-threatening, if it needs to be stabilized, put on oxygen, treated right away, that sort of thing. But the scheduled animals are the majority of what we see in here. It's much easier to schedule a procedure than obviously treat an emergency, but scheduling is the majority of what we do.
So this laser is meant just to help heal the feet?
Yeah, that'll help heal the feet. It'll help heal. For this particular bird, we are doing a like a wound area kind of treatment, and that just helps heal the outer tissue. We can do a musculoskeletal treatment, and that'll help heal a little bit deeper.
New question coming in.
Mm-hmm.
How old is the flamingo?
That I don't know. I don't know how old Ampy is. I can find out and let you guys know later, but I do not have that information right off the top of my head.
We have some that are 50 years old. I don't think she's that old.
50 years old, huh?
Yeah.
Wow.
This is Dr. Wilson. She is Director of Animal Health here at Sedgwick County Zoo, and Brittany, one of our technicians here at the zoo. So easy peasy. Laser is one of the really great non-invasive ways that we can help animals heal and treat minor wounds. Okay, do we want to go to our next spot?
Yeah, let's keep moving.
I will real quick do pharmacy. Oh, I just found out that Ampy is 18.
She's 18 years old.
Mm-hmm. Which is, as you heard, flamingos can get up to 50, so she's a youngster in the flamingo world. This is our pharmacy. We have a lot of things in here that you would see in a regular human pharmacy. We use a lot of the same medications that you see in the human world, as well as a lot of medications that you would see in the dog and cat industry. Some of those medications we have to modify a little bit for the animals in our care, because a lot of them are different than just dogs and cats or humans. But we go with what has been used in the past and has been effective in the past. But again, a lot of this stuff is the same as what you would see in a normal human pharmacy or your vet's office.
So, new question coming in. Since, I mean, looking at these rooms, we couldn't fit a huge animal such as a rhino. So right. How do you go about giving treatment to the larger animals?
We can talk as we walk, and I'll show you some of the things that we do. The larger animals, if we have to treat them, we're usually going to treat them in their space. We actually have radiology in here. That little plate that's on the table right there, it can travel. That little plate and this little orange box has a traveling equipment. So a lot of our machines are portable. We have a portable anesthesia machine. We have portable radiology. The majority of what we use can be moved to where the animal is. Back here in the back of the hospital as well, we have large animal stalls. We have hoof stock stalls. We have dangerous animal stalls, and we can go back there and take a peek at those too if you'd like.
Sure.
What's our time?
We're sitting great.
Okay. So in the hospital, when we have animals that stay in our hospital, we have keepers that come and take care of them. Those are our quarantine keepers. The vet techs and the vets do the treatments, and then our keepers take care of the animals, feeding and cleaning and things like that. So back here is our keeper kitchen. And this is where our quarantine keepers make diets for the day and do cleaning and that sort of thing. We have, on the other side of the hallway, we have an isolation ward, which has its own air system. We won't go in there because we've got some animals in there right now. But it has its own air system, so it's not, if we have airborne illness, we can put them in there and we don't have to worry about it going through the rest of the hospital. So I got another flamingo coming through here real quick. I don't know if this guy has a name. This one has a hole in the webbing of its foot and a foot injury. I believe we suspect it is from its neck. So we have been treating this hole in his foot, and we'll treat it initially with bandages, and then as it's healed, we're treating it with ointment as well as laser therapy for that guy as well.
Would,
And I don't have an age on him either.
would you treat snakes in here?
Oh, sure. We treat everything here in the hospital. We have done tarantulas, snakes. If it's a venomous snake, we will have the keepers from the reptile and amphibians department come down and handle the snake for us. But we recently removed an eye from a small red adder. So he's a venomous snake. And we anesthetized him and removed an eye that was causing problems. So yeah, we work on the teeniest ones all the way up to, of course, like our elephants are the biggest guys.
Well, that takes me into Jardine Animal Science class is wondering, how do you treat the little tiny animals? Is it harder trying to figure out if something's wrong with the really small animals?
So the really small guys, like small frogs or small snakes or ectotherms and insects, invertebrates, that sort of thing, those guys are really hard to treat just because they're typically not going to have a whole lot of history of treatment, so we don't have a lot of reference for them as far as treatment goes. Bead medicine is something that's very upcoming and new in our industry, so we don't have a lot of experience with that yet, but that's something that to me is very amazing. That we are starting to treat invertebrates for different conditions. So it's really unique and really neat. As far as we go, here at the vet hospital, the smaller animals are definitely, more delicate. Our doses for drugs are very, very teeny tiny. Treating like the eye of that red adder, I think he was like this long. So his eye was so small. So it was really a challenge to treat the smallest guys. It's also a challenge to treat the biggest guys like the elephants, because where you would take 2 aspirin, an elephant is going to take 70 aspirin. So treating them on the other side of that scale does create some challenges for the biggest and for the smallest.
There's got to be some math involved in figuring that out, right?
Yes, there's definitely some medical math involved. You want to be comfortable with, your fractions and your additions, subtractions, divisions, all of those things. Medical math can definitely be a challenge. We do calculations every day.
So another question coming in.
Do you want to do questions with the flamingo treatment in the background?
Yeah, absolutely.
Kind of watch while we do treatments. So back in the rest of the hospital is just holding areas. There's a primary carnivore ward, which we use for dangerous animals that we double lock, and it has set up for really heavy mesh so that we are all safe around any kind of dangerous animals. I don't know if you can get a good view of what they're treating here. There we go. Sorry, door does change to you. So like I mentioned before, this guy has an injury to his foot that we are working on treating for him. And I forgot the question.
So one question, they're really curious, how long have you been working here, Jenny?
Okay, well, I have been working here for quite some time. I started in 2008 and I worked here for a few years, but then I actually stayed home with my kids. Came back in, I think, 2013 and started volunteering again, and then I was part-time, and now I'm back to full-time. So I've been around for a while. Not always in a working pay capacity, but I have been around, so.
And then they were also wondering, so what do you do if an animal eats something that's toxic? Is there a way to kind of offset that?
So it's going to depend on what it is that they're eating, but each animal is a little bit different. So if you think about if your dog eats chocolate or whatever, something like that. If it's chocolate or something along those lines, it depends on the animal. If your dog eats chocolate, they're going to most likely induce vomiting. Some animals can vomit, some can't. So it very much depends on the animal and what it is they ingested.
So that's pretty interesting. Some animals can't vomit.
Right.
Gotcha. And they're really curious about this laser.
Okay.
And so can the animal feel that laser is one
So
question.
that laser creates some heat, so they can feel the heat of the light of the laser, but beyond the warmth of the laser, they are not really feeling much else.
Gotcha. I hope you all were able to hear that. That was great. So another great question coming in. They're curious, do you also treat underwater animals here?
Well, we don't at this point have a lot of underwater animals. We have a few fish, and we have some aquatic amphibious species, but we don't have anything that has to stay underwater for treatment. If we do like a fish procedure, for example, we will have them out, but we will run water across them so they continue to get oxygen. We have a chemical that we can put in the water to anesthetize them. Depending on the fish, we can do injectable anesthesia as well. But we'll constantly run water across their gills to make sure they stay oxygenated. But really the only animal that has to stay underwater that we would treat is fish at this point, I believe. I don't think there's anything else that we would treat that.
So you run water over them while they're being treated?
Yes, exactly. So they would lay out on the table on a little tray kind of thing, and then we would just run water across their gills and try to keep the area that we're working on dry.
Nice. So here's a good question. They're really curious about you, Janie. They want to know, what's your favorite animal, and is there one at the zoo that has captured your heart?
Well, so there are a lot of animals at the zoo that are really, really cool. This job is always different. We are obviously always treating different animals on different days. It's always changing. One of my absolute favorite animals is the okapi. I don't know if anybody has seen an okapi or can Google your okapis real quick, but they are this just really unique. They have this beautiful long face. Their fur is like velvet when you touch it. It's so soft. But they have a secretion from their skin, so when you pet them, your hand actually gets this really brown, gooey stuff on it. It's really gross, but also very cool. And it keeps that fur really soft and waterproof and keeps all the oils in their skin. They also have a tongue like a giraffe. It's super long tongue. So they are just a super unique animal, and they're also usually very tactile. So we can get in there and give them scratches. We have one that we actually do laser treatment on right now. So we get in there and do his treatment. I think we're at once every other week, I think, for him for laser treatment. So those, okapi is my favorite. Maine wolf would be my second favorite. They're like the supermodels of the canine world. They have these really long legs and they're just super pretty. So those are my two favorite animals.
Nice. And they're wondering about these special glasses that they are both wearing over here.
So they're very fashionable glasses, but they are actually to protect your eyes. You don't want to, when you're doing the laser, because of that bright light, you don't want to have your eyes looking directly at that light when you run the laser on them. So we use those cool glasses to protect our eyes from the laser. So you can kind of see the hole in the webbing. Was he a, how did he get this injury?
It was traumatic injury. We actually don't know how he obtained it because they spend their time in the water, and so water's up to their ankles essentially. So we don't know how he actually got it. The keepers just found that he was lame, so he wasn't actually able to stand, and when they pulled him out of the water, they saw this. So some traumatic injury, whether he got it caught on something or a predator, right, possibly.
So this is Dr. Arns. She is one of our veterinarians here, and you've already met Brittany.
They were good?
Okay, yeah, all done. So this flamingo is very sassy. Ampy is a fairly friendly flamingo, but that flamingo likes to try to bite at you. Luckily, flamingos don't have really strong bites or teeth. They have little filters in there. So if they bite you, it kind of pinches, but that's about it. Any other questions?
So they're wondering, what is, if you know this, what's the oldest animal that you treat here?
Well, I know that our matriarch elephant just turned 50. We probably have some birds that are older than 50.
And Sweetie Pie.
Hippo, yeah.
Just turned 50.
Hippo, our hippo Sweetie Pie just turned 50.
Who's?
Tortoise. Okay, so we've got some Aldabra tortoises that are 73.
I think she's in her 70s.
Okay, so the Aldabras typically live for a very, very long time, so they're in their 70s.
Well, this was extremely interesting and helpful. We really appreciate you letting us take a look in here. We're down to just a couple minutes, so if you have any more questions, get them in there quick. And one thing we like to close on with these is, you know, we have a lot of our animal science students watching, and we just really curious as to if you had a piece of advice to give these students, what would that be?
So education is obviously always important. You can do, as a veterinary technician, we do a 2-year program, but there are also other programs out there if you wanted to go on and actually become a vet. You're going to spend, you know, obviously more time getting your education, but that's where it's at, is getting the education. And then if zoo medicine is really where you want to be, volunteering at your local zoo in some sort of capacity. We obviously have volunteers here. Joanna is our volunteer that you saw earlier. And then volunteering out at the zoo to help zoo staff as well. So if you want to get into zoo medicine, get your foot in the door as a volunteer, and then make sure you get your education.
It's a lot of fun out here. I've been lucky to get to spend a lot of time here doing these field trips. So you heard it here. Come out and volunteer. Thank you so much to the Oliver Animal Hospital and to Sedgwick County Zoo. This is your good friend Clint and Jenny, and we are signing off. Bye, everybody. Have a great day.